Hello, parents. I'm Dr. Dhanya Dharmapalan. I'm a consultant in pediatric infectious diseases at Apollo Hospitals, Navi Mumbai. And today we are going to talk about tomato fever. And it has recently been in news. Few states have reported, Kerala, Haryana, etc. Recently, center has issued some advisory. Now, what is this tomato fever? Actually, the name is a bit misleading because it has nothing to do with contact or consumption of tomatoes. But in this disease, which is seen in children, the rash appears like red blisters and has an appearance like tomato. It's bright red in color, and thereby the colloquial name for it as tomato fever. But it is actually a subvariant of, it is actually a variant of hand, foot, mouth disease, and is caused by the virus which is called as Coxsackie virus. And it is easily transmitted through, among children. How does it transmit? It transmits through droplet infection, that is when someone is in very close proximity, through the secretions that are transmitted through air while coughing, sneezing, or by direct contact with the blisters or the secretions of the body. So it spreads by uh, basically respiratory as well as contact. Therefore, you can hear about outbreaks happening where in schools or daycare centers. Now, what happens in this is there is high fever at the onset, and there are these rashes which appear especially on the hands and feet, involving the palms and soles, and they are red color and fluid filled blisters. And many children have ulcers inside the mouth. Now, generally, there is no complication that is alarming for this disease. It is a self-limiting disease, but children, because of those ulcers, they are sometimes unable to swallow food and water because of the pain. And sometimes some children may be finding it difficult to even swallow their own saliva, so there is little bit drooling, especially in the smaller children. So how is it managed? Now, are there any other associated symptoms? Yes, because of the inability to drink liquids, there could be mild dehydration during the initial phases especially, and some children may feel joint pains also. Now, how the management is basically aimed around relieving the symptoms of fever and the pain that is felt. So the best medicine that is given is paracetamol. It is the safest fever medicine which can be given to control the fever, and as well as the pain in the, especially when the lesions are present around the throat and it causes pain while swallowing. The most important thing is to maintain hydration. So give a lot of liquids so that the child is at least able to pass urine well. It can be juices, can be milk, but make sure child passes urine. And the other aspect is that you must have a good hygiene. So give bath daily, or you can use lukewarm water. Do not try to break the blisters. And since it is so contagious and it is predominantly seen in children less than 5 years, but it can happen in older children, adults usually do not get affected. So whenever your child, these symptoms are present in the child, please make sure your child is kept at home, not sent to school or out to play or mix with other children, because it can spread easily to other children. So to summarize, it is a self-limiting viral infection which we see as an outbreak because of its transmission to close contacts easily. But fortunately, no complications. One just needs to keep the child at home, and you can give simple medicines. There is no special antiviral medicine for this, and usually the recovery time is somewhere about 7 to 10 days, and the child stops being contagious to others till when the lesions all dry up and fall off. So that is the period of recovery, 7 to 10 days. Thank you.